Okay, so in today's video we are going to be talking about the correct way to pick up things from the ground. This could be picking up a box, picking up a young child, doing different occupations like gardening, working out, anything that people do commonly day to day. So, and on my screen there is one side showing the video that we are going to be discussing, and the other side showing some notes that I took on this video. So, in the last video that was done and published, I was speaking about the muscles, ligaments, joints, and all the things about the back, and how they have different mechanisms, and how they help the body do different movements. In this video, we will kind of tie that in together on how this helps picking up a box. So as stated before, we will be discussing this video on the left-hand side by Revival Performance PT. The question they were asking was, have you been picking things up wrong, and which is the correct way to pick up the box? To answer the question before we begin, I believe that side A is the correct way to pick up a box. Now we're going to transition to the right side of the screen, where I wrote down some notes that I took about the video on different topics. So the first one is why side B is wrong. So to begin with, as you can tell, there is very obvious differences. On side A, he's bending at his knees, going up and down. On side C, he's pushing hips back, but also going into flexion into his back, like this, bending at his waist. So, the bending at his waist puts the vertebral column into excessive flexion, which could lead to a strain. So as we talked about in the video before, that excessive flexion is counteracted by the longitudinal ligament and ligamentum flavum, which tries and limits flexion by bringing the body back with extension into midline. Do not try to put too much strain on the back. So the question is, like, if these ligaments and muscles are doing the action of bringing the body back into midline, why are we getting injured? So a common miscue is that misunderstanding that people don't quite know is that since you are picking up an item that is excessive weight, that has to be accounted for, leading to it being hard to actually get back into the upright position and leading to a strain to the column. As said before, this is leading to a strain in the vertebral column and the muscles, just because they are primarily using the muscles in the back to try and go back into the center of gravity, instead of how on side A, where he's also using the force of his legs to push him through and stand upright. So ligaments aren't the only susceptible injury type. This goes into the second section, where muscles are susceptible to strains. Ligaments will be susceptible to sprains and those types of injuries. So, what muscles are susceptible? So if an individual has a weak core, this could lead to increase of injury due to there being no assistance in stabilizing the spine, once again putting more strain onto the back muscles as they're going upwards and not engaging their core. So the group of muscles that are at risk is a group of deep muscles that are characterized in the erector spinae group. The erector spinae muscles are made up of the iliocostalaces, sorry for my butchering, longissimus, and the spinalis. These muscles are responsible for strain, extension, and rotation to maintain posture. When improper lifting takes place, when someone is bending at the waist, this puts strain on those deeper and smaller muscles as they try and extend backwards, just like that. So, in the third section, we'll be talking about improper box lifting. So the first point is that there's no strain on the erector spinae muscles just because since the individual's not going into excessive flexion and is bending at their knees, instead the back is in a straight and neutral position instead of being horizontal. There's also other muscles that help assist when you're using the proper mechanics to lift a box up or anything that's off the ground. Those muscles are trapezius, rhomboids, and latissimus dorsi. The lats are used to maintain posture due to the muscles going from the scaps all the way down to the lumbar region. They help stabilize the spine as we're keeping the back straight and neutral. Rhomboids assist in maintaining good posture with the shoulder blades and spine, as the rhomboids assist in shoulder retraction, so our shoulders are down and back instead of being rolled forward and like kind of hunched over, which help shoulders being rolled forward kind of puts the body in a position where they wants to go into a flexion of the back going forward. The traps are just like the rhomboids, where they help stabilize the shoulders back and down, back into scap retraction. So the correct way to approach the box I kind of wrote them down into steps. So step 1, assess the load and weight of the box to get a perspective of how heavy. You don't want to go straight into it where you're just like, oh, I got this, and just like lift up. No. 2, you want to make sure your feet are good in a position. You don't want them to be too far or too close. You want them at like shoulder width apart or a little wider than the shoulder width, depending on the load and the size. Then bend at your knees when squatting down instead of bending at your waist. So bending at your knees instead of bending at your waist, which you can clearly see he's going into the squat position, squatting down instead of going forward, defying gravity. And then you would get a proper grip on the box, so grab it in like that, grab it and go upwards. You don't want an improper grip, just because that will lead to like you could have some difficulty picking it up and falling over. Step 5 is keep the box close to your body at waist level and closer to your center of gravity. I feel like that is a very good step that you will need, just because if it is a way that causes more like not necessarily tension but excessive weight load being further away from you, like you're carrying it outwards instead of closer towards you. And then use your legs to straighten and become upright, as you can see on the left side where he's pushing through his heels and coming up. And then last step, if you are having to change directions, don't twist at your torso, instead move your feet to change directions. So that is basically it for this video where we talk about proper box lifting. Some main points and main takeaways are to don't bend at your waist, bend at your knees instead, because if you bend at your waist, that is excessive strain on muscles from the erector spinae group and ligaments such as the longitudinal ligament and the ligamentum flavum. To put emphasis, I'm not too sure if I clarified, but it would be the posterior longitudinal ligament, just because that is the ligament that limits excessive flexion, as the anterior ligament limits excessive extension. I'm so sorry if I did not specify that in the beginning, but I just wanted to do a quick recap, and I'm glad I pointed that out now. So it would be the posterior longitudinal ligament that will be susceptible to sprain. Yep, so that's it for this video. Hopefully this helps you properly pick up a box or do occupations. This technique would be perfect for different occupations, as I stated before, like gardening, picking up a small child, playing a sport, and things like that. Thank you.